Hello, we are Medivery University Hospital. I'm sure you've all heard of the disease called cataracts before. A cataract is when the lens of the eye becomes white and cloudy with age, resulting in vision loss, and it can be caused by a variety of factors. This video provides an overview of cataract symptoms, types, prevention, and treatment. Our channel provides information about diseases and medical health according to a Japanese physician. If you are interested, please subscribe to our channel. Cataract symptoms. Cataracts are classified into several types depending on their cause, but the majority of cataracts are age-related senile cataracts, in which the lens becomes white and cloudy with age and vision deteriorates. The lens plays the role of a camera lens in the eye, adjusting the light that comes in from the outside and bringing it into focus on the retina. Cataracts are a disease in which the lens, which is originally transparent tissue, becomes cloudy and white. When the lens becomes cloudy, light cannot be delivered to the retina, resulting in symptoms such as glare and vision loss. In the case of senile cataracts, the lens becomes cloudy from the periphery and the cloudiness gradually progresses toward the center. Therefore, in the early stages of cataracts, there aren't as many symptoms, but as the cataract progresses, then the following symptoms will appear. 1. Light feels too bright. Light is always delivered to the retina through the lens, but as the cataract progresses and the lens becomes cloudy, incoming light is diffused and reflected and may cause light to feel too bright. 2. Vision appears hazy. The lens of your eye can be compared to a camera lens. A subject viewed through a dirty lens appears blurred and hazy. As the cataract progresses, the lens, which acts as window, becomes cloudy, resulting in blurred vision and blurred objects. 3. Loss of vision. As the cataract progresses and the lens becomes increasingly cloudy, it blocks incoming light and prevents sufficient light from reaching the retina, resulting in vision loss. 4. Different visibility during the day and at night. The eye regulates incoming light by contracting the pupil. In bright light, the pupil becomes smaller to limit the amount of incoming light. However, in dark areas, the pupil becomes larger to increase the amount of incoming light. In the case of senile cataracts, the lens becomes cloudy from its periphery, so that even if there are no noticeable symptoms in well-lit areas when the pupil is small, in dark areas when the pupil becomes large, the peripheral cloudiness blocks the passage of light and may cause difficulty seeing. 5. Myopia, nearsightedness, has progressed. As the cataract progresses, the affected lens hardens. As the lens hardens, the refractive power becomes stronger and symptoms of myopia, also known as nearsightedness, in which the lens comes into focus directly in front of the retina, may appear. While it used to be difficult to see close-up objects without the use of reading glasses, the cataract may make close-up objects appear more clearly. 6. Things appear to be double or triple. As the cataract progresses, a person may have double or triple vision when looking at an object with one eye. This is called monocular diplopia, double vision in one eye, and occurs when there is an abnormality in the cornea or lens. The lens has the ability to bend incoming light, otherwise known as refractive power, and this refractive power serves to deliver light to the retina. However, as the cataract progresses and the lens becomes a mixture of cloudy and transparent areas, incoming light cannot pass through smoothly, and light is scattered when it enters the eye. This can cause things to appear double or triple. 7. Difficulty reading fine print even with reading glasses. Typical symptoms of presbyopia are difficulty in seeing nearby objects and difficulty in reading fine print, which can be improved by wearing reading glasses. However, if the symptoms do not improve with reading glasses, it could be due to cataracts. This is the reason why cataracts are often discovered only when people go to have their glasses replaced, thinking that the strength of their glasses needs to be adjusted. We have described the typical symptoms of cataracts, but since symptoms vary from person to person, it is important to visit an ophthalmologist for an accurate diagnosis if you experience any abnormality. Types of cataracts. There are various types of cataracts, but senile cataracts, cataracts that appear with old age, account for more than 90% of all cataracts. Other types include congenital cataracts, which can be caused by getting an infection while in the womb, traumatic cataracts, which are caused by receiving a strong impact on the eye, and cataracts that are associated with systemic disease. There are various types of cataracts that differ in the way they progress and the age of their onset. Senile cataract, age-related cataract. Senile cataracts are said to be one of the most common eye aging problems that occur in everyone as they get older. The lens is composed mainly of water and protein, and plays the role of a window and blocks ultraviolet rays. It is said that an increase in reactive oxygen species due to continuous exposure to ultraviolet rays over many years causes the proteins in the lens to degenerate, resulting in senile cataracts. When you hear the word cataract, you may have the image of a disease that develops at a very old age, but in some cases, people develop cataracts as early as in their 40s. In senile cataracts, the lens generally becomes cloudy from the periphery, and the cloudiness gradually progresses toward the center. So there are no noticeable symptoms in the early stages of the disease. However, even in the absence of noticeable symptoms, a cataract may be observed under an ophthalmic microscope. How to prevent cataracts. A cataract is an eye disease that causes the lens to become cloudy. There is no medicine that can restore the cloudy lens to clear, and surgery is the only treatment for advanced cases. Although eye drops are available to slow the progression of the disease shortly after its onset, their effectiveness varies from person to person. So the general advice is that the time to consider surgery is when you feel that your vision has been affected. There are many factors that can cause cataracts, including aging, birth, eye disease, and injury, although it is impossible to address them all. So here are some tips on how to prevent cataracts on a daily basis and how to delay their onset. However, these methods also vary from person to person and may not be effective depending on the timing one begins to implement them. Eye drops slow the progression of cataracts. A diagnosis of cataracts does not mean that you need to rush to undergo surgery. Senile cataracts, which account for the majority of cataracts, cause clouding from around the lens and have few noticeable symptoms in the early stages of development. Generally speaking, the time to consider surgery is when symptoms such as blurred vision and vision loss begin to affect your daily life. Since medication cannot restore the cloudy lens to clear, the only fundamental treatment is surgery. However, if the cataract is in the early stages, eye drops may be able to slow the progression of the disease. Since the goal is only to slow the progression of cataracts, it is still important to have regular follow-up visits so that surgery can be performed at the appropriate time. There are several types of eye drops that can be used to slow the progression of cataracts, including 1. Pyridoxine, Keriuni, Catalin. Pyridoxine is meant to delay cloudiness by reducing the buildup of proteins that cause lens clouding. Side effects may include swelling of the eyelids, itching, redness, and irritation. 2. Glutathione. Glutathione has an antioxidant effect and might help to maintain the clarity of the lens and reduce the progression of cataracts by slowing the increase in the proteins that cause the lens to become cloudy. Side effects may include itchy eyes, redness, and temporary blurred vision. Eye drop treatment may not have the desired effect depending on the degree of progression of the cataract, the age of the patient, and the timing of the start of treatment, so be sure to follow eye drop treatment according to a doctor's instructions. Improved diet. In recent years, lifestyle-related diseases such as diabetes, arteriosclerosis, heart disease, and hypertension have been on the rise due to poor diet and lack of exercise. Diabetes in particular causes various eye diseases such as retinal diseases and cataracts. Since an unbalanced dietary life causes the production of reactive oxygen species that accelerates aging, a regular and well-balanced diet is very important to prevent cataracts, which are an aging of the eyes. Consumption of antioxidants. Reactive oxygen species cause aging, oxidation in the body, but the human body has a defense system called antioxidant action that slows the increase of ROS, and the eye also has a system with the same antioxidant action. When we see, light passes through the cornea, lens, and vitreous humor in that order, and is caught by the macula, which is part of the retina at the back of the eye. Lutein and zeaxanthin are abundant in the lens and the macula, and they protect the eye from harmful light such as ultraviolet rays and blue light. In addition, polyphenols, vitamin C and vitamin E, which are also necessary for the function of lutein and zeaxanthin, have antioxidant properties and should be actively consumed. Moderate exercise. When we are young, our body's antioxidant function is active, but as we get older, this function declines. Therefore, strenuous exercise can cause the increase of reactive oxygen species. On the other hand, moderate exercise such as walking can be expected to improve blood flow, which is thought to be effective in preventing cataracts. Poor blood flow can cause a variety of diseases as well as diseases of the eye. When blood flow is improved, the supply of oxygen and nutrients is activated, and at the same time, it helps to discharge built-up waste products. Since there are so many capillaries in the eye, improved blood flow also helps prevent eye aging. Blocking ultraviolet rays and blue light, improving diet, moderate exercise, and taking supplements are only expected to have preventive effects and are not guaranteed. In addition, the effectiveness of preventing cataracts or delaying the onset of cataracts is subject to individual differences, so results cannot be guaranteed. Timing of cataract surgery. Cataracts are an eye disease that causes the lens to become cloudy. Unfortunately, there is no medication that can restore the cloudy lens to clear, and surgery is the only treatment for advanced cases. The timing of cataract surgery varies from person to person. For example, for people whose professions require them to read fine print or perform delicate tasks, vision plays an important role in their profession, as well as taxi drivers, and drivers in the transportation industry must consider the timing of surgery for work-related reasons, as they are unable to renew their licenses without a vision of 0.7 or better. In addition, multifocal lenses that can improve presbyopia, at the same time as treating cataracts have recently been introduced, so those who are suffering from presbyopia are more able to consider surgery as an option for treatment. What happens when cataracts progress? Cataracts rank as the leading cause of blindness globally. In developed countries, medical advances have reduced the rate of blindness caused by cataracts. But in developing countries, the rate of blindness is rising due to a lack of medical facilities and the standard of medical care. Cataracts are a disease with a very high incidence because they affect everyone at a certain age. Therefore, in developing countries where the level of medical care is low, there is no choice but to leave cataracts untreated because either there are no hospitals where people can undergo surgery, or they are unable to afford the cost of surgery. In Japan, with the establishment of surgical techniques, the rate of blindness caused by cataracts has improved to 3%, and cataracts are now recognized as a treatable disease. This 3% figure is also mainly due to neglected cataracts, and it seems possible to further reduce the rate of blindness by having surgery at the appropriate time. Physicians' comments. As we explained earlier, cataracts are a disease that occurs at a high rate with age, and anyone in their 50s or older who has concerns such as, "My vision is excessively blurry," or "My eyesight is deteriorating," should see an ophthalmologist. Also, cataracts are not only senile cataracts which are associated with aging, but congenital, traumatic, as well as can be caused by other injuries and diseases, especially diabetes mellitus, which is a common situation. Cataracts can also be caused by medications such as steroids, by ultraviolet rays, radiation, and other irritants. Diabetes, steroids, ultraviolet rays, and radiation are all risks that can be avoided with care. Try to follow a healthy diet, wear sunglasses when going out in strong sunlight in the summer, and try to live a life that is easy on your eyes. How was this video? We want to know what you would like to see made into a video. If you have any health questions or unexplained symptoms that you're concerned about, please let us know in the comment section. If you found this video informative and interesting, please like and subscribe to encourage us in our future activities. Thank you for watching.